Good morning, folks. The time is now 10 a.m. or make it 10:01. Good morning. We like to start the meeting as ordered. We have a tight agenda. So at this moment, at this time, I want to say good morning to everyone and a reminder to everyone that a lot of you guys have been texting me. I'm going to ask you guys to please sometimes check on the email or the website because I have to stay. I can't do three things. But I'd like to welcome everyone to the both councils, the Brooklyn Advisory Council and the Brooklyn Developmental Disabilities Council. Deborah Brev, who's here at the chair of the Advisory Council, as well as Joyce Levin is the chair of the Brooklyn DD Council. And I'm Christopher D. Grives. Again, I am the vice chair for the DD Council, but on the advisory, I am the corresponding secretary on both you can say both hats. First of all, to remind everyone, we do have housekeeping rules that we must follow, and I do need to remind people who do not follow procedure to please mute their systems. Please mute, because it shows very rude and does interrupt the systems. Like if someone else is speaking, we have to keep microphones in order at the same time. So please, folks, I understand it is a lot of frustration. And you try to hear, but we do need to remind everyone to please mute at this time. And I apologize for a lot of people really okay. Madam Chair, can you still hear me?
Get the two advisory council members on.
Okay, but at the same time, someone is being. I've got to remind people, please mute because it's a lot of interference into this meeting. So I am going to remind everyone, please, guys, mute. I have to do. I got to check everything. I am muting everyone. I'm muting everyone right now. No. I have to concentrate. Thank you. I apologize, Madam Chair, but there are 5 people muting. It's interrupting the system. I have to try to keep it order.
Hear me. They're saying that it's invalid ID. That's all I'm saying.
I don't know then. I don't know if they're using something. If they didn't update, I don't know. I can't help right now. I'm
all right. No problem.
Guys, this code was in and I have got in myself. Let me start right now because I'm trying to get things running. We're very behind schedule. Again, first of all, good morning, everyone. Hope everyone's doing well, and I'll just keep the screen off right now because it seems there's too much interruptions to get something back online. First of all, I want to welcome everyone to another meeting. We remind everyone, number 1, on housekeeping rules. During the meetings, and if you're on the computer, you must keep your systems on muted because 5 people muted could interrupt the computer and interrupt the mic systems to people. Please be very careful because some people might have trouble hearing. We need to keep the microphones on 2 people or 3. The max is 3. Anyone else interrupts, it will be muted immediately. Not many times, but we are reminding you. Second, on your board on the bottom has a hand raise. Please use it. It is available on your computer. If it's not on your tablet, please use the chat box and say, I have a question. That is not a problem because then I will check them out at the same time. But at the same time, everyone who's coming in now should be putting their name. If you're an agency, parent, or an individual, please put that name in. That is the main thing. Please make sure, everyone, that you have your paper and pen. We will be doing announcements in a little while. And just to remind everyone, I do have to apologize for the screen, but due to the fact that everyone's muted is messing up the systems, I have to try to keep it in stable conditions. So thank you, everyone who put their name in on the chat. And some people who didn't put their name on the chat, well, it just makes it harder to keep track who's in the meetings. So let me just move on to regular procedures. If I can get that PowerPoint back on. And I hope our other speakers will be on later on today because we do have a tight agenda. To remind everyone, as you are coming in and anything else, please make sure that you have your paper and pen. We will be doing announcements shortly as well. So right now, I'm asking is to have a few minutes of silence, as you're aware that we are still in the pandemic. We're still asking you please have a few minutes of silence for the people who and prayer for the COVID-19 and any other, as well as Delta and other things, as well as the flu. And whoever passed away, we send them their condolences and let us have a few minutes of silence. Thank you. Thank you. Um, I need to make a motion to waive the minutes, but the recording minutes are available on the YouTube channel. Please make, I know some of you have watched it, thank you, but recording minutes are also available at this time. I do need a motion to waive the minutes. Guys, I need someone to unmute to say something.
I make a motion.
Thank you, Joyce. I need a second. And she's unmuted, so
Okay, make a motion. Get
you
more
second the
people.
motion.
I second it, okay?
Okay, thank you.
Get the
Okay,
other
then.
two in, please.
There are people on. Please, let's stop. Let's get the chairperson's reports, please, starting with Deborah.
Please, okay, good morning. Good morning, everyone. Okay, apologize. First of all, I want to thank everybody participating. I know it's been difficult. There's been a lot of signal issues over the last couple of weeks also because we've had tornadoes across the United States and storm systems that do affect. And if we have construction in the area, it does affect us. Now, as I said, I'm going to give everybody a brief update of the statewide Family Support Service Advisory Council, where I am the Brooklyn representative. I hope everybody got this message, but as you know, Margaret Puddington is no longer the chairperson of the statewide Family Support Advisory Council. At the moment, she is going to, she is still Manhattan's member and representative due to the fact they haven't voted on anyone else. There was an election. I originally thought it was going to run, and I changed my mind. And, I did what I had to I decided to leave, not to do it. I'm still a member. The winner is Chris Pelagia. I'm not sure if I'm saying his last name correct. Chris is from Region 1. He is the Region 1 representative to the statewide. He has a very diverse background. Also, what's the most important, which is a very big, important thing, is that when he was appointed to the statewide, his child was living at home. His child is still living at home. That doesn't mean you can't run if your child is now in residence. It's at your time of appointment. And we congratulate him, and as we know, we will be working on very hard to see that we get everything updated and fixed. Now, big thing that we've been working on. We originally had 4 members on the reimbursement committee, which is a very important, I would probably say one of the most popular family support contracts. Now, the document was released through, it's a draft. Everything right now is in draft form. So I want everybody to understand it's drafts. It's not the end all. We're still working on it. We're trying very hard to update and fix it so that it's basically as consistent as possible across the state. There's there's two little issues. One, we have to realize New York City is on a separate fiscal year. That means our fiscal year is July 1st, say 2001. It will end June 30th, 2022. Once you leave New York City, the five boroughs, so Long Island, which is Nassau and Suffolk, as well as upstate, I'm talking about right near us, the Westchester as well as Rockland. They're on a different fiscal year. Their fiscal year is April 1st to March 31st. So that can be a little problem, a little mix up. So that may be one of the little differences between New York City and the rest of the state. The other issues we have, which are very important, I want everyone to understand. Upstate is very rural. So certain things that we may take for granted, they don't have. It's hard to get respite, emergency respite. Reimbursement is done different, slightly different, not because they're breaking rules, but because they live in a rural area. Yes, we also have issues down here. The goal of OPWDD, as well as the advisory councils, I'm talking about all 19, is to get it to be basic as consistent as possible, so that we have a more consistent reimbursement program. We also want to make sure that we maintain we hope we can maintain a separate camp reimbursement. We also want to have the goods and services, but what we also need is emergency respite to be in a separate category. And we know how hard that is. And I apologize for background noise. They're doing they're mowing or whatever. I don't know. So we realize that. Another issue that has came up, and I want to address this very quickly. When it comes to getting goods and services, the state dollars are tax state dollars. Okay, so we're trying to make sure that, no, I'm not saying they should go out and buy the latest on Reebok, Nikes. That's not what I'm saying. But we have our children are very hard on their clothes and their shoes and other certain items. So we want that to be understood, that we know we have to, and you have to give really good documentation, which is something the councils do agree on, because we want to make sure the families, because it's not our money, it's at children's, that we are getting reimbursed, because having a child with a developmental disability is very financially taxing to the families. So that's one important thing. We also want to make sure that we work together so that we can keep this program intact. It's extremely important. So we will get back. As more I find out, we'll get back. It's still, as I said, in draft form. We also met our new commissioner. I am not going to try to say her last name, but we met her, and I heard as much as we can. Unfortunately, and I say it this way, why I'm not giving every detail. We had a lot of signal problems with our WebEx, so we were having trouble getting in and out, in and out. But I was very impressed by her. She's very warm, kind, and she showed that she does understand the issues, whether the families like us who live in a very crowded urban area, but also families who live in the rural areas. So it was a pleasure to hear from her. She apologized she couldn't get in at the beginning, but she's still our acting commissioner, and we were very happy to have her. The council will be working with OPWD to fix to update, fix reimbursement, if any other family support services. We are also working on showing how fiscally helpful it is to the families when family support services are being used for our families. So I don't have answers. Anybody asks me questions in reference to reimbursement, I'm going to say this. I'm not completely sure, because, as I said, it's draft form. It's not finished. It hasn't been finalized. We're working on it. We're trying to. If you have ideas or thoughts, please, you can email me through the advisory council. That's bfssac@yahoo.com. And I will try to answer, as I said, or try looking on the OPWDD website through the advisory council's website. I would appreciate. I also want to give one. This is not from the advisory, but this is for just one subcommittee. The chairperson was not able to make it today, and we will have meetings we'll have a meeting next month. We ask everybody to, and I'm not going into any, the only thing is the dates will be on the website. If you need further information, email us and we'll send you the dates. And that's what else I have to say. So thank you very much, everybody, for listening. And Christopher, is Joyce,
Joyce
are
is
you ready?
next.
Joyce, you ready?
I'm ready. Thank you.
All right, Joyce, can you do me one favor? Help me say the new commissioner's name. I apologize.
Oh, Carrie Neifeld.
Thank you, Carrie Mayfeld. Thank you so much. Okay, and by the way, Joyce, if you have any questions about that, we can always talk because I know how important this is. Thanks again for your help.
Thank you. Thank you very much, Deborah.
You're welcome.
Okay, I'm having computer issues myself this morning, so I'm not able to be on camera. Sorry. But welcome, everybody. Thank you for attending the meeting. I'll be brief because I know we have a lot to discuss. But so I want to start out with, unfortunately, the rise in COVID. All throughout New York State, throughout the country, we're seeing a rise in COVID cases. We're continuing to ensure or encourage staff to get vaccinated. There's still a number of direct support staff throughout New York State not vaccinated. And the mayor has come out with a mandate for all businesses, but we're not clear yet on what his mandate is. So again, we don't want to be in a position where we have to tell staff, like New York City did with the teachers and other unions, that or workers, if they didn't get vaccinated, they wouldn't have a job. So we hope to, I'm sorry. I just have to shut that phone.
Joyce, I know that feeling because when people know I'm in a meeting, we gotta ease on the phones.
Okay, sorry. So again, just going back to vaccination, we're working diligently. Again, we've seen that rise in COVID, and we don't want to go back. Okay, so in that vein, the legislative breakfast, which normally we hold in March this year, will again be virtual, and all 5 borough breakfasts like we did last year. We will be doing the same. We decided, the 5 chairs again cannot. We cannot hold anything in person yet. We felt it wouldn't be safe. So we're going to do a virtual legislative breakfast again. It'll be early March. As soon as we have a date, we should have a date early January. We'll send that out. Okay. And then just one other thing I want to begin also bring to everybody's attention, that we're still having workforce issues. With hiring people, there's still a large vacancy problem, and we've working with other agencies, with our IAC and the New York Alliance, to work on the workforce issues, but it is a big problem. We have management staff that are covering shifts. And if they're covering shifts, then they're not able to run the house. So anybody who might know anybody who's interested in working as a direct support professional, please let us know. We're also working diligently with IAC and the New York Alliance on getting the legislation passed through the feds to bring the money down so we can give those specific staff the raises and bonuses that have been promised once that legislation passes. And that will be a significant amount of money for that level of staff. So we're excited about that, but we know we need the legislators to pass that both in Congress and the Senate, and then funnel the money down to New York State. And then the last thing I'd like to talk about or congratulate Suzanne Timmerhans from IAC on her retirement. Suzanne has been in the field of developmental disabilities for many, many years. I knew her as a colleague many, many years ago when she worked for another agency, and has been for the last several years at IAC, giving us great information, especially related to the clinics committee and things like that. And we appreciate Suzanne so much for all her dedication and hard work to the field of developmental disabilities. We will miss you very much, Suzanne, but I know that you will enjoy your retirement. So thank you. And with that, I would like to introduce Suzanne from IAC.
Unmute. There we go. Well, thank you for that lovely introduction. And now I don't have to announce my retirement. And yes, I've worked with many people here in Brooklyn and the other boroughs as well throughout too many years. I won't go into how many years it's been that I've been working in the field. Here at IAC, we're working on a number of issues, and I'll just sort of give you a quick summary of what's happening. OPWD did recently, just the other day, issued the rates for all of the different programs that are available on the department website. So people are now looking at those. They also issued guidance regarding the EFMAP. That's the money for the bonus to the DSPs for the appreciation for working throughout the COVID period. The one stickler right now is that the ICF staff, since that's a different category, ICF is a federal, oversight on that as opposed to state oversight. So they weren't eligible for the FMAP monies, but OPWD is working on getting the feds to agree to allow them to include ICF staff. So that would be all your DSP staff would be receiving bonuses for COVID. Another thing that's happening in terms of OPWD is, and thank God it's not happening downstate, because of the staffing crisis, not only are our programs facing it, OPWD is facing it as well. A number of state-operated residences were closed upstate over the Thanksgiving holiday. Basically, people took their individuals home, their family members home for Thanksgiving, and then on the Friday after Thanksgiving got a notice not to return them to their residence because their residence had closed and that they needed to go to a different residence somewhere else. So a lot of families upstate are very upset about this, as you can imagine how disruptive that is to an individual's life. The notification was overnight and so on. So we're not sure exactly what the outcome is there, but again, thankfully that's not happening downstate. There has been some rumors that maybe individuals from state ops will be moving into provider residential programs. However, all the providers are, as Joyce mentioned, experiencing staff shortages as well. In terms of IAC, we are fighting regarding the staffing crisis, and we're working also through the Provider Association as well as the NIDA in convincing the governor to sign different bills that would help in terms of releasing monies to providers so we could increase the salaries for the DSPs, and hopefully that will address to some extent the workforce issue. And we're also working very hard to convince the governor to sign the bill in front of her that would give parity in terms of tuition increase for education. Every budget year, the state ed department recommends a certain amount of percentage increase for our 853 programs and 4410 programs that serve the most needy children that the local Board of Ed departments have decided that they cannot provide appropriate education to. They refer them to our programs. Our programs are working with these individuals, these children, and yet their tuition is significantly lower. And then to add insult to injury, each year, the percentage of increase given to the public schools is higher than the percentage increase given to our schools. So this year, there was a bill that passed that said that our schools would receive parity. That's a 7% increase. That's 7% against their existing tuition. It still won't bring their tuition anywhere close to what the public school gets, but it's better than the 4% that the Department of Budget had agreed that they should get. So, the state ed department has always, every year, recommended that this happen, and every year the Department of Budget shoots it down. This time there was legislation passed by both houses that our schools should have parity and should get the 7% increase. The bill's been sitting on the governor's desk waiting for her review and signature, and we've been writing letters and so on. If you go to the IAC website, there is a slide that you can click on, and that will take you to where you can click and send letters to the governor supporting these issues. And I would encourage you to do so. And you can do it every single day. Every morning when I wake up, I go into our website and click and send another letter. So that's what we're doing there. And of course, Chris, everybody knows Chris Trieber is working his butt off trying to get this to happen. It's been made clear to us that OPWD is most comfortable working through the Provider Association when it's going to work with providers. So rather than working directly with us and maybe our committee groups or so on, and I've had one meeting with them and they were like, oh, this really should be taken to the Provider Association. So we're working with bringing through Tom, who sits on the Provider Association, to push for the development of work groups. There was a work group created last year for clinics, joint clinic work group. We're asking that there be one developed for self-direction and another one for community hab respite. And what we're hopeful is that these work groups will just not be a group of people that get together once a month and talk to each other, but rather would have a representative from OPWD as a permanent member. Joint clinic work group doesn't have that. It's providers sitting and talking to each other, and then we try to convince OPWD to join us once in a while. So I'm looking more for a work group that will review the existing regulations, or in case of self-direction, the guidance non-regulations, and really come up with something that would be consistent. Deborah mentioned about the family support effort to try to make consistency as best as possible across the state. And again, a lot of these things sort of fall to the local DDSO, and one person at the DDSO says, yes, you can, and another person says you can't, or another DDSO says, okay, and another one says no. So we're trying to get consistency, and we're trying to get some really effective guidance in place. And self-direction is in great need of it. It's a wonderful program, but it lacks structure and oversight. That's my opinion. The other thing is IAC also meets with the CCOs. We have a CCO provider meeting. We had one the other day, and they're preparing a presentation to our members about case managers. I'm looking to find out exactly what the case managers are responsible, care managers, exactly what they're responsible for doing and what they're not responsible for doing, because there wasn't 100% transition of the responsibilities of the case managers to care management. So there's things like DDP2s, housing checklists, and so on. They're sort of like, well, who's supposed to be doing this? And people just, providers point to the CCO points to providers. So we're trying to clear that up. So we're looking forward to that presentation. I was going to mention family support, but I don't need to, because Deborah did an excellent and comprehensive job describing everything that's going on. And again, we're looking for that guidance to come out. and it's been a while in the development. And one of the things that came out of the CCO, which sort of impacts upon family support as well, is that the startup time between a family and an individual going through the front door, getting the information that they need to get a care manager, and the assignment of a care manager can be anywhere from a year to 18 months. And the reason it takes so long is because of the approval process of different evaluations that have to be in place and so on and so forth. So we're going to be looking at that whole process and seeing where there are breakdowns. Through my clinic committee, I'm going to be looking at the availability of psychological assessments and what would hold up a family from being able to access that service so that they can get through the process and get a care manager assigned to them. Because until they get a care manager, they can't have the CAS, they can't have the life plan, and they won't get services. You know, unfortunately, at the end of it, there are a lot of people that have been assigned services that are not getting them because of staff vacancies. So again, we go back to the staffing crisis. The ComHab respite work providers at IAC inform me that anywhere from 40 to 50% of their caseload is not served at this point. That's not people waiting for services, that's people that have been getting services, but because of staff vacancies, they no longer are providing services to these individuals. The CCOs don't seem to know. I've asked them over and over again, what percentage of the services that are on the life plan are actually being delivered? Not that you have a life plan that says you get, 12 hours of care management, of ComHab and 4 hours of respite and everything. And meanwhile, you're getting nothing, what's what. And there's really, I don't know whether they don't have a way of knowing or it's just very complicated given the volume, but they're not able to answer that question. So I really think we need to look at this. Just because people have been assigned a service doesn't mean anything unless they're actually receiving it. And that's another push for the workforce issue is how many people are sitting at home with a life plan in front of them that's just a piece of paper with a lot of signatures at the bottom of it. So that's what's going on at IAC. And my last day will be, actually my last working day will be the 30th, since we're going to be closed on the 31st, because if the holiday falls on a Saturday, you get the Friday off. And I'm looking forward to just sort of relaxing, spending some time with my husband and doing some volunteer work with a local mental health group in my neighborhood. So thank you. And that's my report. Unless there's any questions, again, please check out the IAC website. The slide will take you right to the advocacy groups. There's all kinds of links for sending, it's one click, click it. If you want to modify the letter that sits there, you can. If not, you just click, you put your name in, and it goes out. And you can do that every single day. You have to wait 24 hours because one time I did too early in the day, it wouldn't accept it. But once a day, you can send that letter. And the more letters, especially with the staffing crisis, the more letters, the better. We want to really just put a big dump of letters on the governor's desk so that she can say, she is supportive of our services. I suspect that her hesitancy with signing this might be there's other priorities that are taking her attention away from it, and or the Department of Budget is pressing. Right now the state is flush with cash, but that may not be the situation, 2 years out, 3 years out, and investments that we're looking for would have to be carried on later on. So we don't know why, but hopefully the governor will step up and sign all these things and we'll be in better shape. Thank you.
Thank you, Suzanne. And I'm going to say as vice chair, as well as my other hats, I will definitely miss you because I did listen to you a lot of times in the meetings and places. And I have to say, we will miss you very much, but volunteering, helping is very important because I always love volunteering, helping my fellow people with disability. Doesn't matter what type of disability. It is important to help them wherever you can do and give them the guidance of that. So I just wanted to say thank you for your service, and we will definitely miss you. Chairs, Which lady's going to go first? If you have any questions for her,
I
And then-
do.
go ahead.
Okay, first, Suzanne, thank you for complimenting me that I did a good report on family support. It's not easy, but I have a few suggestions and that may help the Governor Stein for us. You need to, and if it's possible on the IC, set up somehow where the parents can send pictures of their children who look how they look now. This is for the pay so that we can have family can have services. It does help when they see a face. It makes it harder for them to say no. Number two, in reference for the preschool, I've said this for many, many years. My son was not able to participate in preschool because he was right before when they started that. And I was a parent member for years. I wish he could have, but all right. I know I'm not crying about it. But one thing I've noticed, if you have a picture of your child when they're in preschool, and now they are, and let the legislators and the governor know, especially state ed too, and whoever it is, my child got up to this, but do you think maybe if there was the more children like mine could do even better if we had the right funding and that the classrooms weren't empty? The other issue I do have is with our current mayor who thought, we started the kindergarten for 4 years old and 3-year-olds. Well, I'm sorry, you're not helping the families who have children with any form of developmental disability or other disability. So we need to also form strong partnerships with this new coming in mayor. And you see, he also has acknowledged he has dyslexia. And we need to let him know that if they test the child's eyes to see how they learn, how they can read or not, and also do auditory and hearing tests. So to know if they have auditory, that would be a big help. But we also have to let them know that with all this help, if you don't also plant the seeds for the future with the children, then forget it. What are we going to have in 20, 30 years? So again, also congratulations on your retirement. Yes, we will miss you. And also, please tell IAC that maybe they should come to, should ask some of the advisory council members across the state to assist on these different work committees. Because, yes, we see things in a little perspective. And yes, there are families on our councils that are professionals, and they're very much welcome because they have two insights. They're a parent, but they also see what goes on in the workforce. But again, thank you so much. Sorry, Joyce, if I took too long.
Okay, thank you, Deborah. I did write down all of your recommendations and I will share them with Tom and Winnie. Thank you.
Thank you.
Joyce?
I just wanted to say thank you to Suzanne for the presentation and again for all of your work throughout the years. Good luck.
Suzanne?
Yes.
No, I'm just making sure you heard Joyce.
Yes, I did, Joyce. I was about to write just a thank you to everyone for all the kind words. And I am looking forward to retirement, but I will miss being in the throw here. That's for sure.
Does anyone else have a question for her? So there's none on the chat at this time.
Nobody else. I just want to add one more thing.
No.
One second. Maybe we should also ask AARP because they have a very strong legislative body to assist us too. That's it.
Okay, Joyce, we're done on IC, so I will move on to our next person. Nina, are you there still?
Yes, I'm here. Do you hear me?
Yes, I do.
Okay, I'm gonna try to turn on the camera, and if I freeze, you can tell me. You can let me know. Okay. Good
If
morning.
I can hear your voice, that's even better.
Okay. Good morning to everyone. Suzanne gave a very good, very comprehensive update on OPWDD activities. Thank you, Suzanne. I just want to add with the topic on incentives, workforce incentives, the approval of the funding that came through the Appendix K. I just want to say that OPWDD, we held the webinar on December 2nd with the providers, and we guided providers through the documents, through the approval, and how these money can be paid to the providers. We are waiting for, I think it will be a second technical webinar offered to the providers that will discuss how the billing or how the providers will be submitting their claims for the reimbursement. And currently, we are working on the attestation that every agency will have to, the CEO will have to sign the attestation form, and that will be returned to the to OPWDD in the beginning of January, and then we will be releasing funds. So that's just closing the loop on the update for the workforce incentives for the funding. The other thing that I wanted to mention, that you're probably aware that on November 4th, the Center of Medicare and Medicaid issued an emergency regulation for staff care health for the staff vaccination, and which requires basically some employees who are working in a certified setting on the Medicaid and Medicare programs to be vaccinated against COVID-19. And in our world, in OPWDD world, that applies to employees at ICF, DCs, developmental centers, specialty hospitals, and Article 16 clinics. However, on November 30th, the federal judge in Louisiana issued an injunction against CMS in a case brought by several states who objected to the CMS mandate. This injunction is in place until the court reaches a final decision on the case, or until CMS successfully appeals the court's ruling. And so because of this injunction, OPWDD cannot require our employees to receive the vaccination by December 5th. That was the date that was initially established, but we are encouraging employees to get vaccinated for their own safety and others. With the FMAP, so my next quick update would be with the FMAP. On November 18, Governor Hochul announced that OPWDD will provide over $1.5 billion in one-time ARPR funding to support recruitment efforts, retention incentives, and vaccination bonuses for DSPs at nonprofit provider agencies. And all of that information, all our initiatives are available on our public website at opwdd.ny.gov on the American Rescue Plan funding map page. So you can access that information on our website. And I think that's it for me today. I know that Susan mentioned that the state is working on getting payment for the ICF employees and for workers in the day treatment programs. And we are trying to mirror the investments of workforce reimbursement to the workforce. And that's it for me for today. Do you have any questions?
Nina, this is Chris. We do have 3 questions for you. But before I do those 3 questions, Joyce, do you have a question for Nina? Joyce?
Yes, sorry. I actually do have one question, Nina. The monies were approved for the direct care staff in the 200 code, but we have maintenance staff, cook, housekeepers in the 100 code. And we know right now that it's not approved for them, but they worked through COVID just as, diligently as the direct support staff. So I just wanted to know if there was any update on obtaining approval for the staff and the 100 codes also.
Mhm. Um, I can take this question back, and because I'm not aware of that, I think that Appendix K was clear that the current approval is for DSP for workforce only, and Diana, during the webinar that was presented, I think that we were given the codes, right, 200 for who were supposed to be identified as DSP workforce. But I'll take your question back to the central office.
Okay, I appreciate it, because the cook, housekeepers, and maintenance, they work side by side with the direct support staff. So you're going to have one staff doing a similar job, getting those monies, and the other staff who worked just as hard to ensure the houses were clean, the people, the cooks, that people were fed, and they won't be getting that, so it's a disconnect there. So thank you.
I'll get back to you on that, Joyce.
Thank you very much.
Madam Chair from the Advisory Council, do you have a question for
Yes,
Nina?
we do have a question. So I would like Nina to find out for us. Sorry, I will pass on the question right now. I'm sorry, I have an emergency call.
Okay. All right. Well, then I'll go on to the three questions, Nina, from people. The one question is that has been brought to everyone's attention is there any changes? And I think this question was mentioned also at the Provider Information Committee the other last week, but this question is still coming in. Do we know what the new changes are at the Brooklyn DDRO?
The new changes at the Brooklyn DDRO. I don't think that we have new changes at the Brooklyn Regional Office. I'm not sure if Lucy has joined us, Lucy Amazi. She's our Community Service Administrator. And I oversee Brooklyn and the Bronx, and Lucy is in charge of all operations in the Brooklyn Regional Office.
That I think you answered that question because the person just gave me a thumbs up. The second question is, due to the fact that we are still in pandemic procedure, what is your procedure now regarding mask wearing and covert procedures? Due to the fact that one thing I'm going to add this bonus, we are dealing with the flu and the pandemic at the same time. Any special procedures from the DDRO and PWDD that we need to be alert on? I know number one is hand sanitizer, and forgive me if it disappears on the screen, but I'm holding a New York State hand sanitizer. But any other procedure, because I know that a lot of individuals do not want to wear paper masks. It's dangerous for the asthmatics, but washable masks, I know they're available, but any procedure if say they cannot wear those or face shields?
We are following the guidelines issued by DOH, Department of Health, and CMS. And you probably heard the announcement from the governor not long ago about the requirement of wearing masks indoors. So that's the current requirement, that unless the person is actively eating, people should be wearing masks indoors. And the other thing that I wanted to mention, restriction, there are no restrictions in visitation policies. And if the residence has some COVID cases in the facility, then they'll have to follow the protocols established by the DOH and then by OPWDD, and that information is available on our website.
Thank you, Nina. I think it did answer. The other question is when you do have a chance, can you please put your email on the chat, please, if you have a chance?
Yes, absolutely, will do.
It seems everyone's always asking every month for your email, and I have to remind everyone, your email is available on our website.
Mhm. Mhm.
So I do like to remind everyone her Okay, so I feel like you hear an echo. No, just maybe just me. As you see, everyone, she puts on the email. Please give her a chance. She does get back to you as soon as possible. Just like me, I will get back to you as soon as possible. But remember, I will get back to you with an answer like someone like she will. Give her time and relax. We don't want. I think Nina, you agree with me as well as Joyce and Debbie agree with me. We don't need everyone stressing yourselves. Feel happy, feel proud, but stay strong and New York tough. That's what I'm wearing today. Let me just check. There's a chat. Nope. Nina, we're good unless Deborah has a question, but she seems she's on an emergency phone call right now. So let me just check before because I know
Yes,
we
I
got to
have
move on.
one question. I just make it. No, it's really. We're not having problems like they're having upstate with the children having to be kept at home, right? Am I correct about that, Nina?
With children being what?
Like what's happening upstate? The parents have to keep their kids home because the houses are closing. We don't have that here. Is that true?
We do have the providers who are consolidating programs.
Okay. All right, I understand. Thank you. And I apologize, but I have this emergency call I must do. I apologize. But I'm listening. Please forgive me. Sorry. Thank you.
Since no one else has any questions, Joyce, you don't have any additional questions before I move on?
No. Thank you, Chris. Thank you, Nina.
Thank you, Nina. And Nina, happy holidays.
Thank you, Nina. Happy holidays, and thank you for everything. Thank you. Appreciate
it. Thank you.
Okay.
At this time, we are up to announcements. But before I do announcements, Gavin Myers, are you with us? I know I saw you coming in.
Yeah, hi, I'm here.
Yes, we have. Go ahead.
I can give a report from DOH. So I wanted to start out with a little information about the vaccine mandate. For those who don't know already, there is a vaccine mandate starting December 27th for all employees at private sector businesses, and they must have received at least one dose of the COVID-19 vaccine. And this requirement will not be limited to businesses in certain industries or based on company size, which is a previous mandate. And so this one, further details will be announced today. However, there's also the possibility that this might get slowed down or blocked, but at this point, this is the city's vaccine mandate. And part of this is coming along because of the Omicron variant. For those of you who haven't heard, there's currently evidence from the World Health Organization, which has classified Omicron as a variant of concern. And the variant of concern is one classification that the WHO uses to track COVID. It is now spreading in New York City. There's community city, and we do not.
Excuse me, Gavin. I'm sorry to interrupt, but you're
this variant.
Excuse me, Gavin. I'm sorry to interrupt you, but you're talking very low. Can you? Oh, there you go. Your signal was going in and out. Can you repeat what you just said?
Yeah, sure. I said the Omicron variant of the virus that causes COVID-19 is spreading in New York City, but we do not yet have reliable evidence about whether the variant is easier to spread or more likely to lead to severe illness or able to avoid the antibodies from the vaccine or previous infections. However, as mentioned, there are some early signs that it may have the ability to spread more easily. And so as a result of that, we strongly recommend everyone, including people who are vaccinated or were previously infected, to wear masks in all indoor public settings, which was mentioned earlier. And so the Commissioner of Health also developed an advisory for Omicron masking, which I'll put a link to in the chat right now. it'll tell you more sort of in-depth information about what I just said about Omicron and the importance of wearing a mask. It was a health advisory that he issued pretty recently in the last few weeks because of Omicron. So again, obviously, continue to wear masks indoors where possible. In terms of vaccines, the COVID vaccine is available to all New Yorkers now ages 5 and older. And in addition, booster shots are available to anyone who is fully vaccinated ages 18 and older. And the only requirement really for the booster is that you need to have gotten your vaccine at least 6 months ago or longer. And these shots are really designed to boost your immunity from the initial vaccination series. And we are recommending a booster shot for any adult who received the second dose of the Pfizer or Moderna vaccine at least 6 months ago, or 1 dose of the Johnson & Johnson vaccine at least 2 months ago. And your booster shot actually can be any of the 3 authorized or approved vaccines. So you don't have to, if you received the Moderna series, you don't have to receive your 3rd dose as Moderna. If you receive the Pfizer series, you don't have to receive your 3rd dose as Pfizer. We are recommending just to continue with it if you can, but it isn't required. So you are able to have some flexibility in which vaccine you select for your 3rd dose or your booster dose. And I also wanted to provide some updates now about case rates in New York City. I always like to provide those updates each meeting, see how COVID is changing month to month. And currently, what we call our test positivity rate is 3.56%, and that's increasing for the daily average. That's a measure of sort of one measure that we look at in the community to see, sort of how fast COVID is spreading. And we also have about 2,317 confirmed cases of COVID, and that's increasing as our daily average for the last 7 days. While that being said, the good news is that while the cases are increasing, hospitalizations and confirmed deaths are currently stable. So that's a very good thing. Citywide, the number of new cases, this is another measure we look at per 100,000, is 243. And I like to pull the Brooklyn numbers for you as well, and it's actually 242 per 100,000 in Brooklyn. So the health department's current focus is on vaccine operations, trying to get the vaccine out to as many people as possible. And along those lines, the percent of adults who are fully vaccinated is now up to 82% at this point. And among those who have only had the first dose, we're at 90%. So we've really gotten these numbers up dramatically, but we're still looking to get these numbers up even more. So obviously, if you haven't been vaccinated, we really are strongly emphasizing the importance of that. Brooklyn is at 77% fully vaccinated, and we're meeting with state partners to work on regs and expectations for vaccination, distancing, and mask wearing. And as previously mentioned, if you are going to have your child get the COVID vaccine, that's going to be the Pfizer vaccine only at this point, available for children ages 5 to 11. And the dose is smaller for that age group. In terms of transportation, we still are offering free transportation and in-home vaccinations for people who need it. So I'll include in the chat a link to calling a number where you can get transportation or receive an in-home vaccination if that's something that's useful or important to you. And then finally, if you can, please also get the flu shot at some point, as we are sort of entering the flu season, as Chris mentioned. And so, definitely the flu is sort of the second thing that we're going to be battling this winter. So those are my main updates, and I'll include my email as well in the chat. So if you have any further questions, thank you.
Gavin, this is Chris. As you see on the chat, can you please email me that so I can add that to the website? Because we've been getting a lot of families do get the information from our website. So can you please put that information to that email address you see here, so both councils can have that information available?
Sure, the information about the Omicron advisory.
Everything what you just said. Please send me that information.
Okay.
Let me start with our chairpersons. Debbie, you want to go first? Because your hand technically. Debbie, you want to go first?
Definitely. Hello. So
And then
long,
I'll get Joyce.
I haven't heard from you for a while. So now my questions are this. I want also, I would like you to email me the list of where I can get my Johnson & Johnson booster. And I also would appreciate you go back to the New York City Department of Health and Mental Hygiene and tell them that I want all, and because they work and HHC works with them, I would like more places like HHC and other hospital settings to also carry the Johnson & Johnson, the regular vaccine and the booster. I know some people say, oh, you can get the blood clot. But let me tell you, there are people like me who are only allowed to do one vaccine because of other health issues. So please include that in. It's very important, Gavin.
Okay. Where to get the Johnson & Johnson vaccine, yeah.
And booster.
And
And
any
also
booster.
the pressure. And I would like to see all hospitals and clinics have that option too. It needs to be spread out more. All three should be spread out so people have a better choice. That's what frustrates a lot of people. You want to do the right thing, but if we don't have places to know where to go, that makes it harder. Thank you, Gavin.
Thanks.
You're welcome.
Joyce, do you have a question for Gavin?
No, not at this time. Thank you.
Thank you. Thank you, Gavin.
Thanks.
Thank you. Moving on to announcements. Sarah Thompson, your hand was up first. Can you please unmute yourself? And then will be Carrie Banks. Sarah Thompson, I know I saw your hand up. Can you unmute? I'll have to make this announcement quick for her because I know she was on. She wanted me to make this announcement, and I apologize right now. My system is doesn't somehow. There's a lot of microphones going on at the same time. Okay, let me just do that. There we go. Just to let everyone know that on the next, just to let everyone know that you should have gotten it on an email. Normally the holiday train used to run, but Sarah Thompson wanted me to make sure this was in the announcement, and it's actually on the system. That please remind everyone, starting this Sunday and the 3 Sundays, they will be running by the holiday train line. We are retiring the R32 trains that will be running from 2nd Avenue Houston to 145th Street. This information is available also on our website, and information was emailed to everyone. So please pass the word and remind everyone you still have to wear a mask on the subway. Mask Force is this Friday. Please, if you need that information, please talk to me on the chat or definitely on that. Let me start with Carrie Banks. Carrie?
Hi, all. Good to see everyone. I put a couple of things in chat, but I want to call people's attention to our workshop at the end of January on mental health resources for children and families, and this and teens and families. This includes people with dual diagnoses. We'll have a representative from Department of Education's Project Hope, as well as someone from the Puerto Rican Family Institute. Project Hope will be talking about school-based mental health resources, including counseling, and Barbara Bonham from Puerto Rican Family Institute will be talking about community-based mental health resources for people who need them. There's just so much going on in families' lives right now that, and this is an important thing. Everyone is under a lot of stress, and we need to be addressing it. So that's on January 26th from 5 to 6:30. You can come after school, you can come after work, but do come and check out the resources. And a couple of great concerts to help you relax and enjoy. Also coming up this month, And that's on January 8th and January 23rd. Those are Saturdays at 2 p.m. These are autism-friendly concerts. We have we have picture schedules. We have performers who are comfortable working with this audience, and they're just a great time. So just, register, play it in the background, or sit and enjoy. If you want to sit with us and follow along, you're going to need some instruments, I should warn you. So we hope to see you Saturday the 8th or the Saturday the 23rd. And remember that all of Brooklyn Public Library's locations are now fully open. Though socially distanced, masks are required. We don't have our usual capacity for computers. But in-person programs are coming back. In-person distanced programs, indoor programs for adults and teens are coming back to some branches. So look for your local branch and see what's going on. Thank you. If you have questions, I'll put my...
Does anyone have a question for Carrie?
I do.
Oh,
Go ahead. Let's go express, please, because we're behind schedule.
Quick, Carrie, this is quick. When you say limited computers, what do you mean? Just one 30-minute session? I just want to clarify. You know why?
Well, yeah, it's always just one 30-minute session, but also we're not using every computer, right? Because we want 6 feet.
Every other? Okay, I
every other
understand.
computer, right.
Okay, got it. Thank you.
You're welcome.
Okay.
Thank you, Carrie. Happy holidays.
Happy New Year, everybody.
Yes. Moving on to Dolores Kahn.
Good morning. My name is Doris Kahn. I am the outreach coordinator for New York State Institute on Disability. We're a family support service agency. I first want to wish good luck to Suzanne on her retirement and thank you for all the years of your service. And I want to wish everyone a happy holiday and happy new year. NYSED has openings for evaluations for individuals who do not have Medicaid for the purpose of obtaining OPWD eligibility. Please call Elizabeth Sunshine at 917-699-0578, or you can email her at esunshine@nysidinc.org. We also have openings for our crisis management services. This service is given virtually for now. And for information, contact Juliet Hawkins at 917-524-4856 or email Juliet at jhawkins@nysidinc.org. NYSED also provides reimbursement for goods and services in individuals who reside in all 5 boroughs. And for this, contact Jackie Tripodi at 929-202-1115, or you can email her at jtripodi@nysidinc.org. NYSED also has tickets for venues for individuals who reside at home that live in the Bronx, Brooklyn, Queens, or Staten Island. For information about these venues, call Sarah Alton at 718-494-6457 or email Sarah at salton@nysidinc.org. NYSED also provides transportation services for medical appointments and for these recreational outings for individuals who live in the Brooklyn, Bronx, and Staten Island. Contact John O'Grady at 917-747-9424 or email him at jogrady@nysidinc.org. All this information I put in the chat. Thank you.
Thank you, Dolores. Let me move on to Jill. Let's make it quick because we do have a speaker and we're very behind schedule. And then Mary Christopher will be the last one for the hands up.
Thank you.
Yeah.
Thank you. I tried to put on my video, but I've been having connectivity issues, and I want to first apologize. I could not sign into the chat. The chat is not loading for me. But I do want to announce that AHRC's advocacy program does have openings for educational advocacy for children ages 3 to 21. Any issues with the Department of Education or kids not receiving their needed services, I will share the intake phone number. It's 212-780-2799. I'll repeat that, 212-780-2799, or you can email educational.advocacy@ahrcnyc.org. And again, I apologize, for some reason the chat's not loading. I can't drop our information in the chat today. But please call or email if you need help, and the children have to be OPWDD eligible. Thank you.
Thank you, Jill. Joyce, go ahead.
Okay, Mary, I think you were the last one that was going to have an announcement. You got like 1 minute.
No, I will give you 1 second. Okay, I'm thankfully today I had time in my schedule to be able to log into this meeting. It has not been an easy school year. I am hoping to resume some, at least the transition committee meeting for after the first of the year. I'm probably going to be shooting for February. I'll be sending out more information, but I'm going to shoot to resume, even though I don't have a co-chair. I would like to hold a meeting, and I'm going to be shooting for February. Okay, so to be continued. I just want to let everybody know that I would like to try and get the committee somewhat active again. Okay.
Joyce?
Thank you, Mary.
You're welcome.
Okay, I'd like to thank everyone, but right now we do have a speaker. Ryan, you there?
I'm here.
Okay, you can share the screen.
But it doesn't look like it's loading.
You guys can share the screen. You're ready to go.
Yeah, how much time do you want me to do, Chris? Is 10 minutes okay?
You have plenty. You're fine right now doing the presentation. The meeting doesn't end until 12. So if you want to do like a 20-30-minute presentation, then we can do questions and answers.
Okay. Well, I won't. I'll just go as I was planning then. Hold on 1 second.
Yeah. Just be advised that, as Joyce said earlier, there have been power surges, and it's not coming from me. It's somehow somewhere, and I think it is coming from Staten Island and parts of further parts of near Bay Ridge. There have been a power outage because there are right now disruptions on trains. So I know it's not just me.
Yeah, and I could vouch for
ironic
Staten
because
Island
my
because I'm
co-president
freezing every 3 minutes.
is from Staten Island. So, Lewis, can you hear it? And Lewis is in Staten Island right now, and he's having some connection issues. So I'm just going to kind of ride solo on this for as much as I can. But Lewis, if you fix those issues and you want to jump in, feel free to do so. Okay, so Chris, you can see my screen, right? Give me a thumbs up.
I can see it beautifully.
It's what?
So can I. It's fine. I can see you. New York Alliance Risk Willers. This is Deborah Bright, the co-chair. Yes, I can see it.
So thanks, everybody. Thanks for having us. Thanks for allowing us to come and speak today. My name is Ryan Cox. I'm from the New York Alliance for Inclusion and Innovation. We're a provider agency, or provider association here in New York. We have members from, it's a statewide association. So we're from the tip of Long Island all the way to Buffalo. We're here today to talk to you about a risk resilience website that we've created. And this is not, before I get into it, it's not a New York Alliance product. It was, grant. We were awarded a grant through New York Community Trust, and we were able to develop this website and these resources that I'm going to talk to you about today. You don't have to be a New York Alliance member to access them. So I want to make that point right up front. It's that, this is a resource for everyone, provider agencies, individuals, family members, anybody. And it's free to everyone. So just want to kind of state that up front. As I mentioned, this was a grant from the New York Community Trust. And the idea here is to provide a resource for everyone to kind of plan for the unexpected. So plan for catastrophic events. Obviously, the grant was awarded to us because of COVID. So there is a bit of COVID preparedness and risk resilience aspect to it, but it can be used for a number of different unforeseen circumstances. And the overall idea is just to kind of expect the unexpected and plan for events that might be out of your control. And what are those processes and procedures that you need to have in place in order to scale down or scale up appropriately, depending on the emergency situation that we're in. So we have a website out there. It has a number of resources that you can access, as well as a risk resilience strategy document, which we call the business continuity plan, which will help you, kind of organize all your thoughts into one comprehensive document that will hopefully allow you to be responsive and resilient during times of emergency. And the other important component about that is that you can, work collaboratively on that document with members of your leadership team or members of your household, depending on, how you want to structure the business continuity plan. And like I said, it's free for everyone. So, at the very least, please go and check out the resource and the website. I'm going to send my slides to Chris and Joyce after we get done with this presentation. It has the website links and my contact information, Lewis's contact information. So if anybody's interested, please feel free to reach out. If you have any questions, we're always here to help. So first of all, how do I get access to this resource? The website address will be on the next page. It simply requires you to create a username and password. The reason why, we ask you to create a username and password is because it links to your specific business continuity plan, which I'll talk about a little bit later. But that's the comprehensive document that allows you to do that planning. And like I said earlier, multiple users from each agency can log in and work on the business continuity plan at the same time. You don't need to be a New York Alliance member, and the resource is free. So just want to state that up front as much as possible. So the actual risk resilience toolkit, the website address is in your upper left-hand corner. It's basically bifurcated into two main components. And you'll see this kind of if you go in and play around a little bit. But the first component is the resources. We have a number of resources that are available that are designed to kind of help you. And there's a number of COVID resources, there's general resources, but just go in and kind of check it out. The idea here is that you might not find everything interesting, but there might be some resources on there that might be able to help you, your agency, even individuals kind of plan for specific events. And then the other component is the business continuity plan, which I talked a little bit about earlier, and we'll go into in a little bit more in depth as we move forward. And just, God, Lewis, did you want to say something? I saw you percolating there.
No. I just keep freezing. So you all keep freezing. I'm not freezing, but so I'm sorry if I'm not too much involved. But I just wanted to mention that some of the resources.
It's okay. I got control. Go ahead.
We got control. Everything's under control. Continue.
Okay, some of the resources are webinars that have been recorded by really some great experts on grief and loss and recovery, as well as resilient leadership. So it's a really good resource for folks. And Ryan keeps saying, it's free and you don't have to be a member. So there's really no reason not to check it out, but I think you'll find it really useful.
Good point. And Lewis and I get paid by the amount of time we say it's free during these presentations. That's why we keep repeating it. Like Lewis mentioned, there are a number of resources on, the resources section of the website. There's webinars, there's a resilience quiz. I recommend that everybody kind of go in and just kind of get a sense for, where your agency or, where your organization is at by taking the resilience quiz. It'll kind of give you an idea of, where you stack up. There's infographics that are good for, posting throughout the workplace on risk procedures and risk resilience activity. There's COVID specific resources on the website too. There's information on vaccination, information, as well as a number of other COVID related resources that you can access. Excuse me. This is important for, training of staff, risk assessment of your own agency. The infographics are good reminders for staff if you want to put them out in certain strategic places within your agency. And as I mentioned before, there's a lot of vaccination info because, I got my booster the other day. Moderna, so I was really excited about that. So we're encouraging everybody to get their vaccines and their boosters, and I think that hopefully we can find our way out of this thing. So we have some resources on there that speak to the COVID vaccination data as well. And then the other component besides the resources is the business continuity plan. And the business continuity plan is really, the way that I think about it is it's a document that'll help your agency kind of prepare for the unexpected. And the idea here is that it organizes you into specific modules that are specific to different categories that will help you find what you need to do in terms of what processes you need to scale up, which ones you need to scale down, what contacts you need to be aware of, who's responsible for what within your organization during an emergency situation, and what processes and procedures you want to keep going and which ones you can get rid of. So for instance, you might need to continue payroll and accounts receivable, obviously. What processes and procedures do we need to put in place in order to make sure that payroll is continuing in times of emergency? What can we scale down? Maybe we can agency tours because of risks for a number of reasons. So that's, how do we do that? Who's in charge of that? That sort of thing will come out in the BCP. And the important thing, and I say this about risk resilience all the time, is like, COVID was very unexpected. And a lot of times, emergency situations are very unexpected. It's important to have a plan in place before you get to that point where you need a plan. So that's kind of the gist of the website. And that's how we're hoping that everybody kind of thinks about it and wants to utilize the website. The BCP, or the business continuity plan, is scalable. So, you can do the basic module, which takes, I've done it, it takes 20 to 30 minutes. It's very low touch. Not a lot of requirements in terms of overall agency involvement, but then it scales up to a very comprehensive business continuity plan, which I would recommend that you'd want to involve your whole leadership team on and really put some time and effort into it if you find it valuable. I think that's really important, is the ability to kind of go along these steps, and you can keep going forward in terms of how involved you want to be in the process and how much time and commitment you want to put into proper risk resilience planning. So moving on to the next slide, I think I mentioned the BCP modules, and this will kind of give you a visual representation of what I'm talking about. The overall, overview BCP module is 6 questions. It's like I said, it takes 20 to 30 minutes. It's very basic in terms of, wrapping your head around what you need to do in terms of an emergency situation. You identify those mission critical functions, which activities you want to scale back, and which, topics you need to discuss with your leadership team in the event of an emergency. The intermediate BCP is kind of the next step. If you decide to complete the overview and you want to go to a more involved process. So, this one has 12 questions in 2 modules. Like I said, this is kind of the point at which you'd want to involve your leadership team, I think, in these discussions. And the important thing to know about this website is that, once you create a username and password, you can link yourself up to the other people within your organization to kind of work on it simultaneously. And once you complete the business continuity plan, it spits out your plan that you can print it out and just have it as a reference document for emergency situations. So we really think that it's, an important thing to do in order to have proper planning in place. And then the final comprehensive business continuity plan is pretty involved, I'll be honest. This is the kind of thing where, if you are, an agency that wants to make sure that you have a very comprehensive plan in place with all the contacts that you need, all the procedures that you need to follow, everything you want to scale up and down during any given emergency, this is what you probably want to complete. Now, like I've said, this is not specific to COVID. This is, for various different emergency situations. So depending on the emergency situation, your response might change. So within the comprehensive module, it talks about, what kind of emergency is this? Is it a flood? Is it a fire? Is it a terrorist attack? Is it a, extreme weather event? Those sort of things. It's like Hurricane Sandy, for instance. If you had a business continuity plan in place, you would have everything that you needed to know and all the procedures that you needed to follow in one spot that you could reference for you and your team during the emergency. So that's kind of the value that we want to prescribe for this website, just in terms of the business continuity plan.
And we believe that the work that you put up, and this, I don't have to, I'm preaching to the choir here, but that the work you put up front is going to pay off in the end when you come up with these crises and disruptive events, and not just to survive, but to continue to thrive during this. And I think we've all learned that lesson in a very challenging time. So I think it's important that, I think, and it's also it's a good practice and training for your team and critical thinking about how to deal with situations like emergency situations like Ryan has described.
Great point, Lewis. Great point. And I think involving your team as much as possible up front, I think will pay dividends in the long run, because it gets everybody kind of acclimated to the process, what's involved in the continuity planning overview. So I think it's really important to involve everyone up front, which speaks to, the fact that you can link up everybody that's working on it at the same time. So
And
just
No, Ryan, before I freeze again, I just wanted to throw this in there that, we do provide, that is, we, New York Alliance, provides technical assistance to agencies, and we will be willing to meet with your website, go through a practice of the business continuity plan. And we've done so with some very well-established agencies. And, despite how established they are and the infrastructure that they possess, there were still things that they also learned from each other that they were not aware of. And that's what's really important about it. And people need to keep it current. So.
Great point, Lewis. And you kind of froze at the end there, but I think, what you were saying was that, you'll learn things along the way as you go forward through this process. And sometimes, take a look at the resources, go through a business continuity plan. Sometimes when, you work on a process, you kind of find more questions than answers sometimes, and that's good. And the business continuity plan will help you to answer those questions. There's a lot of pre-populated kind of modules. So the way that it works is a lot of things are pre-populated that you can kind of cater to your own individual wants and needs, or you can, continue with the pre-populated, examples as you go forward. So just one quick thing that I wanted to mention, as an overview of the website, what I recommend to everybody is, register for the website. We'll send you this PowerPoint and the link to the website. I'll put it in the chat when we're done. But just check out the resources, take the risk assessment quiz, do the overview of the BCP, which takes 10, 20 minutes, 30 minutes maximum. And then you can decide if you want to move forward or continue with a more comprehensive BCP. But at the very least, just please check out the resources. Obviously we did this because we want to provide information to everyone that, that might find it valuable. So this is not, anything that we're trying to sell or anything like that. This is already out there. And we just want to make everyone aware that it's out there if you might find it useful. So, that's kind of our spiel. Lewis's email is there. My email is there. My colleague, Kathy, is at the top, and our risk resilience website is at the bottom. So, Lewis, I don't know if you wanted to say anything further here.
No, just again, if I froze when I was saying it, that, the New York Alliance will provide technical assistance to your individual teams and yourselves. So feel free to take it, let us know, and email us, and we can arrange it.
Yeah. Feel free to email any of us. We'd love to talk to you. Love to hear from you. And obviously, if you have any questions, we're here to be able to.
You keep that PowerPoint on with the email address, because some people were writing it down.
Sure. Let me just pop it right back up again.
Yeah. And I'm going to ask everyone has any questions for the speaker, please raise your hand, or please, so I know who you are. So therefore, we can keep it in order. But before I do that, I am going to ask Joyce, do you have a question for him?
No, I don't. Thank you very much for your presentation, Ryan and Lou.
Thanks, Joyce.
Thank you. Thank you for
Deborah?
having us.
Yeah. Deborah, do you have any questions?
Yes, I do. First, I want to thank both of you for doing this presentation. Now, is this also will help us families? Because not all of us are working and running businesses. Will this help us too?
Absolutely, and that's one of the things that I've kind of been learning as well, Deborah, as I've been working on it too. Is that this can help you your own family in a family emergency situation. Like I said, some of the modules within the business continuity plan have emergency contacts, things that you need to prepare for. So think of it as is designed for business continuity, but it can also be used for household continuity as well. So that's kind of how I think about it. And I've actually had some conversations with my family about what we would do in an emergency situation based on some of the modules in the BCP. So good question.
Well, thank you, because but you see, I just want to bring up a point, and thank you for this. But we have some families that only one person is technically able to handle everything. Do you have points where, say, like the rest of the families have disabilities, and no matter what you say, that you tell us give us what we can do? Do you have that in that website? Did you understand what I said?
Yeah, no, just restate your question. I don't think I understood correctly.
Right. Okay. We have families who have children with developmental, maybe some other disabilities, that only one family member is capable of understanding the website or how to do this. Do you have tips that will help these families?
Sure. Yeah. So there's a lot of resources within the resources page that will that kind of speak to that situation. I don't know which specific resources would be applicable to in every situation. So I would encourage everyone to just explore and see. Some resources will work for some people, some won't work for everyone. And like you said, there are families with one person who is responsible for a lot of the decision making. I think that's kind of akin to like you're the CEO of the family, so to speak, and that's kind of like your role within your particular family structure. So I think that a lot of those similarities can kind of still apply.
I appreciate that, because you do need help when you have a family member with disabilities.
100%. 100%.
All right, and this site is free. I want to make sure I heard it right. It's free for us to use, correct?
It's free. That's 6 more frees. So
thank you. I'm just making sure I heard it correctly. Thank you.
Well, I like saying that 6 times because then it's clear on the record on the recording. But thanks for saying that. I do have questions that just letting you know, we have some groups, parent groups also, who are doing they have some agencies with them, but they did want me to say they loved your presentation because you broke it down. So they do want me to say, number one, thank you. And they're actually saying to me, thank you for leaving the screen on, because it's given them an idea to write the information down too. The other question is brought to attention. I know this question was brought up earlier. Do you guys do presentations to other organizations?
We will do a presentation to any organization, Chris, that you can think of. Louis and I are at your disposal. We can set up the time to do whenever you want. So this is kind of like, we created this website. We put a lot of work into it, and now we're at the point where we want to tell the world about it. So I'm happy to meet anytime, anywhere. Let me know.
He will. I promise you.
Feel like I'm opening up Pandora's box here.
It's okay. The more we share and help each other, the better our world will be. Thank you.
Ryan, as well as Louis. I know, Louis, your signal's fine, but I can see it's maybe your signal's fine. I can see from here. But Ryan, when you have a chance, can you email me your links and information so I can add it to the website? Then I'll add you to the advocate page. So therefore, people will see this new information will be available on our website beginning this weekend. So So people will see this on recording today, but this will be also linked to our website. And I will check with, and Madam Chair, you're also the co-chair. Maybe we need to add this to the Provider Information Committee. This may be a very good thing to start at 2022.
Yes, I will be speaking to my co-chair and explain to her, because I agree this would be great. It also, as I said, we have to work and share this, and I'll ask the rest of my fellow advisory council chairs too.
Sounds good. And what I'll do is I'll send you the links to the website. I'll send you our email contact information, and I'll also send you the slides so you have everything in one place if you want to put the slides up on your website.
Oh, and by the way,
bonus.
I may share I may request that you do presentations to the local community boards.
Happy to do it. Happy to do it, Deborah.
No problem. I'll get that info for you. Okay.
Okay. Let me get to this next question. There was a question earlier. They didn't hear it clearly. I think it was one of your beginning. I think it was slide number 3 or 4. There we go. How to get access to resources. And I can see it here. Looks, even I can answer that question too, and it's right there too. But I think it's number 4. But at least that's one piece. But I'm asking the
question, Chris. I can't see the chat. Was there a specific question?
Oh no, the chat. What it is the group has a tablet link to their screen, so they're texting me the question.
Okay.
Because we're trying to make it, because some of them can't speak another language.
Got
They're
it.
speaking. So the person who's doing it is speaking another language. So we're trying to make sure they have this. But now they're saying thank you. They actually now got the answer to the question.
Perfect.
So those were the last 3. Those were actually the last questions. Does anyone else have?
Go on the website. When you go on the website, we'll send the link or whatever. It'll bring you to the login page. You just complete the username, which is your email, and then a password, which is, create whatever password you want, and then it'll bring you right into the portal, which has all the resources, the option to pick the resources or the business continuity plan, and then you're in. So that's how you get access.
Yeah, I have to say it was easier for me to get on, because I've been used to getting on with passwords and they don't let me on. But this one was, I have to say, you guys are definitely using something new that I'm actually glad to see, because a lot of the people got to realize we got to keep our systems up to date, and your system is very easy to work with.
Great. Great.
Yeah. Let me just double check. Anyone on our video mode, does anyone have any questions? Why do I have a hunch I sense a Carrie Banks moment question? Carrie?
Sorry, I don't actually have any questions right now, Chris. But thank you.
I'm surprised, Carrie, because I'm used to you by now with questions.
Not this time.
Wow. Wow. So
Oh, she fooled you. Good, Carrie. Thank you.
Carrie
Every
fooled me
once in a
today.
while.
Thank you.
Just want to make sure, or maybe it was Dolores Kahn had that question, but I don't know. I'm just making sure so nobody said I didn't miss anyone.
Well, thank you for having us.
Thank you.
We really appreciate the opportunity.
We appreciate happy and healthy New Year to you all.
Yes, Happy New Year.
Thank you very
Thank
much.
you. You too.
We appreciate and happy holidays to you. Thank you. Thank you.
Thank you, guys. Since now I have to say we did a great job this year, I want to thank everyone. I think Joyce and Debbie, you want to say the last words since it's the holiday season?
Joyce, you want to go first?
Sure. Yeah, I just wanted to wish everybody a very happy holiday season, healthy new year, and let's see those COVID numbers go down next year. Thank you.
And very important, please, everyone. As Deborah agreed with me, I'll let her go first, and I'll say my last.
I want to thank everybody for the last year of help and support. Yes, I know it's not easy to do this by video, but it was a great joint venture, and I really appreciate being able to work with Joyce Levin, and we've been able to reach more people and help. Please, everyone, please stay healthy. Please wear your masks when you have to, or face shields. If you're able to get the vaccine, please, if you are able also to get the flu vaccine, please. I would love everybody to stay healthy and happy. And yes, I wish everybody happy holidays, but rest and get your energy up, because on January 1st, we're going to have to start all we'll give January 2nd. We have to start advocating very hard to keep our OPWDD services, and we have to fight for preschool and so many other things, but we have to work together. So again, I thank Joyce and the DD Council. Yes, I'm the secretary, but still thank everybody. And I thank everyone who's been participating. Thank you for all your patience and help. Thank you. Now your turn, Chris.
I do want to say thank you to everyone who was here today. And I have to say, you guys think the attendance was low? No, it was not. We have links from other people that are linked, who does definitely been speaking different languages. And I have to say thank you to that person, because I did not ask permission, and I'm not going to do that because I'm showing courtesy and respect. But our attendance for even this year, since we've been doing VIO, has gone up a lot. And I do want to thank everyone who have been attending the meetings and keeping track of our website as well, because our numbers are doing well and strong. So I do want to thank everyone who was here today. And please, everyone, make sure you do. We still got to continue next year for advocating, because next year is our governor election, and we got to make sure we keep advocating for COVID or services, especially education. We need to continue to work together. We might not like everyone, but we still have to work together to make sure our future children, even the individuals, people with disabilities, we have to work together in the schools, out of the schools, and make sure we have to work together. We need to put the violence in the past and keep the peace to the future. And I will say peace and love and happy, healthy New Year to everyone. Thank you, everyone. And I know that person who just said thank you to me on the chat, you're welcome, because I know she's like going, oh, God, he's going to say it. Yes, I did. At this time, we're going to say thank you, everyone. Have a great holiday, and we'll see you all in the year 2022. Bye, everyone.
Everybody, happy holidays.
Thank you.
You're welcome. Thank you.